Hello, my name is Dr. Patrick McGrath, and I'm the Chief Clinical Officer for NOCD. If you're looking for help for OCD or related conditions, check us out at nocd.com. That's nocd.com. Today, I wanted to talk about a subtype of OCD where people are afraid that maybe they don't have OCD, maybe they have a different condition like hallucinations, delusions, schizophrenia, psychosis, something of that nature. So I wanted to spend some time today differentiating with all of you what are the differences between OCD and more of the psychosis-based disorders. The first thing to talk about is a delusion. Now, a delusion is a belief that people hold that seemingly nobody else really does, or no one would really agree with. So I've got some in front of me here. I'm just going to give you some examples of what they would look like. Like people are conspiring against you or spying on you or cheating on you or drugging you. Maybe they're harassing you. Someone else is able to read your mind or has placed thoughts into your mind. Maybe that you have a special talent or power or something of that nature that people just don't know about. Or maybe that somehow you're responsible for certain things. Now, you could see a crossover a little bit into OCD with some of that, right? There could be relationships, especially in this idea that I might be responsible for something. In fact, many people with OCD will have an intrusive thought or image or urge, and they feel that if they don't do a compulsion, something bad could happen if they don't do the compulsion. In the delusion experience, people aren't doing compulsions. They're being very afraid that this thing could happen and wondering how they did it, but you don't see them doing compulsions as a way to try to neutralize it. So typically that's one way that you would really go about differentiating some of the diagnoses here. Now, obviously, if you tell people these things, most of them are going to say they don't find that to be true, but many people with delusions will really hold on to these beliefs, even in the idea that other people aren't agreeing with it whatsoever. So it's really firmly held, even if there's conflicting evidence that might be shown to them. Then there's also hallucinations. Hallucinations are perceptual experiences that we have that other people don't experience, right? So maybe I could hear things like voices. I see things that other people aren't seeing. I can smell things that other people don't smell. I have sensations in or on my body that other people aren't having in a similar type of situation. The hallucinations, you're awake, you're experiencing these things. Sometimes we have this hypnagogic kind of feeling, maybe when we're falling asleep, where we might feel a bit out of reality and we can't tell what's real or not. We're not talking about that. We're talking about in the awake state, hearing, seeing, feeling, smelling things that just nobody else is experiencing. And not just a random kind of thing, but that this is a recurrent experience that we see. And again, people aren't doing things to neutralize it. They're usually trying to find the source of it, figuring out where it came from and what they can do to try to eliminate it. But that elimination might be calling the police because, again, you think that somebody is trying to poison you, or because somebody is shooting thoughts into your head, or maybe that you're seeing things that other people aren't seeing and you want the police to come and check it out. Or you might even hire a ghost hunter or something like that because you believe that you're being haunted. All these kinds of things that you're experiencing in the mind perceptually that aren't really there, but you really do hold on to the belief that they are. And many people who have delusions or hallucinations, which could lead to the criteria for schizophrenia, schizophreniform disorder, schizoaffective disorder, depending on the combinations that you might have with various moods and manic symptoms. We could go very in depth in all those diagnoses, but I want to keep it a little bit higher order today. What will happen in those situations that's different than OCD is people with OCD will typically be able to say to you, I get that this is not true or real, but what if it is? And just on the off chance that it is, wouldn't it be best for me to do a compulsion just to make sure that it isn't going to come true? versus people with hallucinations and delusions are very stuck in those things as being true and real. And it is hard to convince them that it is absolutely not the case. Now, the place where this can get tricky potentially is if you have a very low insight OCD, which we also call like a delusional level of OCD, where you absolutely do believe that the obsessions, those thoughts, those images or urges are true. It is a pretty low level of people who have this in terms of the percentages, right? This is not a high percentage of people with OCD. Most people with OCD have good to fair insight. Some have some poorer insight. Rare do you see that delusional level of insight, but it does happen. And when it does, exposure and response prevention therapy can be difficult. The gold standard of treatment for OCD, where you expose people to things that are in their obsessions and you have them not do their compulsions and do an opposite behavior and learn that they can handle living life without doing compulsions. So maybe we combine the therapy with some medication, right? And in these cases, maybe even a low dose of an atypical antipsychotic, which can help to attack that delusion a bit and get that door cracked open just enough that people would be willing to try to do some exposure and response prevention therapy and actually see that what they were holding to believe so dearly is actually an obsession. In these cases with the OCD that's delusional, you are still seeing people doing compulsions as a way to try to neutralize it. They just fully believe that they must do it. There isn't the ability for them, like most people with OCD, again, to say, I realize that this doesn't make a lot of sense, but I'm afraid of what if I don't do it and this thing were to happen? Maybe it's best just I don't take the chance. So that's how I usually look at differentiating some of these. If you feel as if you might have one of the conditions we're describing today, if there is some delusional thoughts of things in your head that other people have tried to convince just aren't real, but you're holding on to that, or if you're experiencing perceptual sensations that other people are not, and if you have obsessive compulsive disorder, if you're experiencing obsessions and doing compulsions as a result to try to neutralize those obsessions, there is help available. For those of you who have OCD, we would hope that you would check us out at NOCD.com. If you're having issues with delusions or hallucinations, I would encourage you to speak to your general practitioner or find a psychiatrist or nurse practitioner or other prescriber who specializes in the areas of psychosis, who can help you find the right medications to deal with the psychotic experiences that you might be having. If you are looking for that help for OCD, check us out at NOCD.com. That's NOCD.com. And remember this, OCD is out there. It's prevalent. It's not really rare, but it isn't always seen or isn't always at the tip of awareness of people, even who are trained mental health professionals. And that's why we suggest that you find a mental health professional who is specifically trained in treating and diagnosing obsessive compulsive disorder. We hope to hear from you soon.